Hello everyone, I'm Dr. Priyanka. I'm a retina consultant in Shekhar Eye Hospital. Today I'll be talking about cardiovascular diseases and how it affects the eye. So when I say cardiovascular diseases, it comprises of multiple entities. So it can be coronary artery disease. So basically diseases which affect the vessels of the heart. It can be stroke. So in this, the vessels to the brain are affected. It can be deep venous thrombosis, in which generally the problem is in the blood vessels, in the legs, extremities. Then it can also be comprised of congenital heart diseases. So kids who are born with congenital heart defects. This also is included in cardiovascular diseases. Then rheumatic heart disease, which is an infective form of heart disease. And then the last one would be peripheral arterial diseases, which generally affects the fingers and the feet, basically the extremities of the body. So the reason why eye is called a window to the heart is quite apt, because the blood vessels which arise from the heart are reaching the eye. So we are seeing the status of the blood vessels and the health of the heart directly in the retina. So when we do a retina examination, we get an idea of how the heart is functioning and if the patient has any defect in that. For example, I'll tell you about one scenario wherein a young gentleman walks in with some blurring of vision or just a routine checkup, and on examination we find out that the blood vessels inside the eye have narrowed down, and also there are some lipid deposits and some fluid pockets inside the retina, and which is quite suggestive of hypertensive retinopathy, which has been there since quite some time. When we check the blood pressure of the patient, it comes out to be very high, and the patient has no idea that the patient is hypertensive. Patient has not been under treatment. So we have diagnosed the patient's hypertension just because of a routine eye examination, or just because the patient had come with a little blurring of vision. So now in this kind of situation, because we diagnosed the hypertension, which is high blood pressure, which was quite high on that instance, the patient is further referred to a physician and is treated for the same. Had he not come to us, had we missed the findings, then the patient would have had a bigger stroke or a heart problem in future if the hypertension was left untreated. So another scenario would be like a patient, say middle age or elderly, coming to us with a blurring of vision which has been recent in onset. So on examination of the retina, we find out that a vein inside the retina has been blocked, which has caused swelling up of the retina. So in such cases, we do a thorough investigation and try to find out why this blockage happened. So generally the patients would already be hypertensive, diabetic, on treatment, or have had some heart issues also. But when it happens in young, we need to be more careful and do some more investigations, both that extra edge to find out why that blockage happened in a young individual. So we put the patient through a few tests and we advise for a physician consultation. And many times we find out causes like increased homocysteine, altered lipid profile, the cholesterol levels is altered, or the hypertension which was undetected. So these things are taken care of just because we found out the problem in the eye. The problem in the eye primarily can be treated by injections to the eye and regular follow-up. But when we look at the larger picture, that we found out what the problem is and we start treating the problem so that this event which has occurred in the eye doesn't happen elsewhere in the body and cause more devastating outcomes. Another scenario will be like elderly gentlemen or even youngsters nowadays, young people, middle-aged people. We see them coming to us with a complaint of a sudden onset, partial or complete loss in vision. And on examination of the retina, we find out that arterial supply to the retina has been blocked. So the retina doesn't get any blood supply at all, and then they develop a loss of vision. So this kind of situation, when it happens, when there is a complete arterial blockage, the chances of visual recovery are very poor and it is almost irreversible. But when we look at the larger picture, once we see that a patient has come to us with an arterial blockage, we advise the patient investigation, especially, the blood vessels supplying the brain and the eye, which arise from the heart. Those blood vessels can be scanned by a test called a carotid Doppler. We also advise for echocardiography, which is ultrasound of the heart, and to treat the patient. So in many patients, we have found out that because there was a blockage in the eye, we found that the blood vessels supplying the brain, which lie in the neck, there is a big block, or basically a blockage which is there inside the blood vessel, and a small element of that blocking element has gone and blocked the blood vessel which supplies the retina. Now let's imagine, had we not detected this blockage, the patient would have landed with a major stroke in future, basically where the blocking element goes and blocks a large area of the brain. So that will be a devastating complication. So this way we have found so many cases wherein the patient presents with an arterial blockage in the eye, and after undergoing multiple investigations and after physician consultation and vascular surgeon consultation, we have found out that there has been an underlying problem, and there have been blockages in the blood vessels which require treatment to save the life of the patient and to prevent stroke and other coronary events from happening. There are few patients in which we have also seen a blockage of both vein and the artery. So in such cases also, we have to find out the risk factor and we need to treat it. So all this is done along with the physician and neurologist's care. So these are few scenarios in which we have, found out the underlying systemic problem, the body problems, because the patient presented to us with the eye issues. A few patients also come with, sudden onset disturbance in vision. They are not exactly able to point out what they are feeling, but on examination of the eye looks absolutely normal. There is no vessel blockage, there is no vein blockage, no arterial blockage. So basically nothing which we can put a finger on. So such patients, generally who are elderly, we advise for MRI brain, and on doing the MRI scan, we find out that there has been a stroke which has affected the main vision area inside the brain. So now, because of this eye finding, we find out that the patient had a tendency of stroke which has as of now affected only a small area, which in future could have affected a larger area. So the patient is referred to a neurosurgeon or a neurologist, and the patient is taken care of to prevent further stroke from happening. There are few patients who come to us with complaints of vision loss happening for a few seconds, and then they regain the vision. So this is also called a mini stroke. So there is a cutoff of blood supply for a few seconds and the blood supply regains. But why did this happen is what we need to find out. If a patient comes with such complaints, we need to do a thorough checkup. We need to do MRI scans if needed of the brain and find out why it happened. Is there any blockage that is there or impending blockage can be treated? So looking at such scenarios where there are so many entities threatening the eye and the general health in, in elderly plus young, we need to impress upon the fact that any vision disturbance, even if you are young or middle-aged or old, any kind of vision disturbance should be, taken care of. You should visit an ophthalmologist and get your complete examination done. You see, the retina especially, it acts as a window to the heart, and we have been able to treat and timely treat so many patients, and it has affected them basically to prevent them from going into a more devastating state of major strokes or heart diseases. Thank you very much. So please get yourself checked if you have hypertension, diabetes, any heart disease. We will be very grateful to help you. Thank you.